Thank you, Mr. Chairman. And thank you for being with us, Mr. Slavitt. I'd like to go back to a little bit of the discussion you had with my colleague from Ohio, Mr. Johnson. I know you had made some comments there at the end where you pointed out that in the real world and, you know, that things are much more realistic and that ideologically many times things seem like they're going to be better than they are. I would say to you, sir, that is exactly why I ended up running for office, being a nurse, because I did see, and my husband as a doctor saw, that the plan that was going forward was not going to be realistic, and I think we have learned over time that that is the case, and that there were many promises made that have not been kept. Well-intended, but not true for the American people. So I do, again, I share with you that same sentiment, but realize too that that is why we feel so strongly about this issue, that the American people do need to see what can be realistic and achieved in good health care in this country and good health care coverage. You did also have an exchange with Mr. Johnson on the cost of Healthcare.gov and what it should have cost. You reluctantly did not answer the question of, you know, the cost being $1 billion. Is $1 billion too much for the implementation thus far?
So, thank you, Congresswoman. I've not seen a study yet which looks at what the appropriate cost for building the entire Healthcare.gov system should be. But of course, I do acknowledge that our colleagues at the GAO pointed out that there were absolutely inefficiencies and waste in the way the contract was managed. So at the very least, we know there was some. I would hesitate to say, though, that it was entirely waste because there was a really significant set of systems built, and I think those systems have significant long-term value for the country.
You know, there again, it gets back to that same issue of what is realistic, what is achievable, and, you know, simply throwing money at it and then looking back in hindsight to determine what did work and didn't. I think we all are learning from this experience, so that of course has value. I don't know how you measure it, but the American taxpayers are still on the hook for this. And that is, again, why we are taking the approach we are, which is, you know, when is it going to be enough? When are we going to achieve the goals at a cost-effective measure? I want to look into some of the issues with security breaches. Are you aware at this time of any problems that the website, from the building of the website, and that there are still concerns? Are you aware of any right now?
So there have been no successful malicious attacks, and certainly to the best of my knowledge, no one's individual data has ever been compromised from the Healthcare.gov website.
So to the best of your knowledge, and just based on the answer that you gave, you are not seeing that there were any related information breaches in Healthcare.gov or traveling through the federal exchanges that you would consider a security breach?
We have not seen any malicious attacks that have been successful, and we've not seen anybody's personal information in any way get compromised.
What is the definition of a successful
Well,
breach?
I'm not trying to be cagey, but other than to say that nobody has successfully penetrated the security system to the best of my knowledge, Congresswoman.
Are you aware of any companies building, operating, or otherwise working on federal exchanges, obtaining access to information that they should not have? Anyone who's outside of the system or working on that have?
Not to my knowledge.
And information on enrollees or applicants, none there as well?
No, not to my knowledge.
Are you aware of any changes to site protocols or standards to address breaches to access information?
I think it's fair to say that the security team does continuous monitoring and makes changes and puts in new patches as as different security things are found out about in the industry and so forth. So there's a continuous monitoring.
Can we obtain that information over time? Any of the changes and updates that may have taken place for the committee?
Sure. Let me figure out what I can share. I obviously don't want all of the things that our security team does to be well understood by the wrong people, but I want to make sure to get you the information you need.
Okay. Thank you, Mr. Chairman. I yield
Thank
back.
you.